Joined by Peterson Wachira, the chairman of the Kenya Union of Clinical Officers, as we have a discussion on the healthcare system in Kenya. Thank you so much for joining us.
Thanks a lot, Harriet, and thanks for having me.
Okay, so what does this mean for the healthcare system after the strike suspension?
I think let me start by saying that we are not going back to work because we are very happy. We are going back to work because the court has seen it fit for us to go back to work. But the reasons that made us walk out of work have not actually been resolved. We walked out of the working environment because it was unsafe for ourselves. But now that we have been taken back by the court, because we say that we are law-abiding union, if the court says that, then we have no option but to go back. But we shall not deliver services if not provided with the right and appropriate protective equipment to be able to do that in a safe environment.
Okay, and were some demands met?
So far, for the Ministry of Health, we signed on 1st of January this year. I think the public so has come out, and I remember the CS saying that we were giving Kenyans a New Year's gift. And we agreed on a return to work formula, which is basically a framework towards remedying that now unsafe environment, so that the medics, they can have a conducive working environment when they are fighting this scourge. And for the Ministry of Health, we are seeing that. We have even seen that they have improved, even with the protective equipment, the PPEs. I've not had a lot of outcry from the members, and I know from the few points that I've checked that they're actually providing. For the 47 county governments as we sit here, for any clinic officer who was employed after 2013, after devolution, for any clinic officer who is on contract, they do not benefit from that medical cover. They do not benefit from the group life, which compensates one once they die. So the same problem we had, and now you know that Corona is coming back, COVID, we are going into the third wave, and you don't know how it will be. In the next about 3 weeks, you will not get a bed in any ICU in this country. I can assure you of that. They're already filling up.
Okay, and now the strike has been recurrent on and off again and all the time. And so where could the core issue be?
The biggest problem with the health sector is the way it is managed. I know sometimes people do not want to talk about it because they don't want to sound political. But until we as Kenyans, we become sincere with ourselves and say the truth, politicization of the health sector was the biggest undoing. Kenyans, being responsible citizens, should also ask questions. They should ask that we are amending the constitution because we have seen challenges, be it the challenges in the judiciary, we want an ombudsman, be it the challenges in the political discourse, we want to add some seats. But what about the health sector, where we as Kenyans have suffered over the past 7-8 years? What is the solution we are providing in BBI for the health sector? That is a very valid question that every Kenyan should be able to ask their leaders, from the MCA to the president, because we elected them so that they can go and facilitate us to get the rights that we gave ourselves under the Constitution. If they do not do that, we must realize that we are the people who hold the power, and we must take them to account to tell us how they have facilitated us to be able to access that right.
Okay, there you've heard it from the chairman of KUCO. It is high time that something changes in the healthcare system for a better tomorrow.